All right, everybody. So here we're going to look at the anatomy of the lower leg, ankle, and foot. So kind of keeping with the theme previously. So when we looked at the hip and pelvis, we also kind of looked at the knee and vice versa. There's obviously going to be some structures here that we had already talked about in regards to the knee. So, for instance, a lot of the bony landmarks and structures on the proximal tibia, for instance, we discussed in the knee joint lecture. So again, it's kind of showing how all of these things are very closely related. Okay, so first we're going to look at the bones of the lower leg and foot. So here are the bones of the lower leg. So we had mentioned the tibia and fibula. So the tibia is the larger, more medial bone of the lower leg. The fibula is on the lateral side. So again, the question here, and we talked about this before previously, which of the two lower leg bones bears most of the load? So which of those two bones, think to yourself, bears most of the load? And that would be the tibia. So the tibia is the primary weight-bearing bone of the lower leg. Again, the fibula bears very little weight, minimal weight, but it does bear some. So that obviously impacts, again, when we talk, injuries, we're all in a rehabilitation science. It takes into consideration when you're recovering from injury to these bones, why it would be different for one versus the other. So here we look at, again, some of the bones of the lower leg and ankle, and you can see some of the tarsal bones. So like in the wrist, we have the carpal bones. When the foot, we have the tarsal bones. Okay, so if we look at you examine the picture here. So number one is the calcaneus, okay, or what, you'd commonly just call your heel. Okay, the calcaneus is the big bone here. Your talus be number two. Your tibia, number three. So we're looking at remember here, we're looking at a lateral view. So we're looking at a lateral view of, we have our lower leg bones here, and then we have the ankle and foot right in here. Okay, four is the fibula, and the pound sign is your lateral malleolus. So that's the distal projection off of the fibula. So if you could remember, what's the anatomical landmark on the proximal fibula called? And if you remember the proximal fibula, you have the fibular head. So distally, you have the lateral malleolus, and the more proximal end, you have the fibular head. Okay, here's a medial view. So you can see on the slide, you can see the calcaneus, you can see the talus, okay? You have the tibia, and then the little star here, you have the medial malleolus. Now you notice the medial malleolus does not go as far distal as the lateral malleolus. You can see this on your own ankle. So if you look at your own ankle, the lateral malleolus is very big. It projects more distally, okay? The medial malleolus doesn't. It's not as prominent, and it doesn't go as far distally as the lateral malleolus. And there's some there's ramifications to that, as far as which injury to the ankle is more common. We'll discuss that a little bit later on when we get into the ligaments. I mean, most of us know about ankle sprains in general, probably because most of you in class have played athletics at some point, and there's a good chance you've probably sprained your ankle. And we'll talk about, just to kind of show for practical purposes, why it's kind of important to see that anatomy, and why one type of ankle sprain is way more common than a lot of the other types. Okay, here's a posterior view of the bones of the lower leg, ankle, and foot. So you can again see, so there's your calcaneus and your talus. You have your tibia. Here you can see the medial malleolus and the lateral malleolus. And you can see again how much more distal. So this is a posterior view. This would be the lateral side, obviously, because your fibula is here. Okay, and then this would be your medial side. So you can see the lateral malleolus has a much further distal projection than the medial malleolus does. And again, I mentioned on the previous slide what the significance of that would be in regards to some of your more common ankle injuries. So we look at the purpose of the malleolus. So, I mean, we have a medial and a lateral malleolus. Besides just being, prominent bony ends, they actually do have a specific function in regards to the biomechanics of the ankle. So their primary purpose is to serve as a pulley and leverage for some of the tendons and muscles that they kind of come across. So what they actually do is they actually allow, if you look at the actions of the muscles where those tendons are, by wrapping around the individual malleoli, they actually allow for their actions to take place, and it also allows them to have more force when they do so. So sometimes the way tendons kind of travel over bones, we talked about this a little bit. It's not quite the same because these obviously aren't sesamoid bones, but we discussed this when we were talking about the patella, when we were looking at the knee. So the medial and lateral malleolus actually do a similar thing. Again, they're not sesamoid bones. They're just large projections off of regular long bones, but still the same idea. So the lateral malleolus helps the peroneus longus and brevis perform eversion. So in other words, because of the way those tendons kind of come across. So if we look here, again, you can see the lateral malleolus. You can see the medial malleolus. Okay. So the lateral malleolus helps the peroneus longus and brevis perform eversion, and the medial malleolus helps the tibialis posterior perform inversion. Okay. So by those tendons kind of coming down and the path they take, going along the lateral and medial malleolus, it allows them to produce that specific function. In other words, if they didn't take that path, the action of those tendons would likely be very different. So here you can see the medial view with the tibialis posterior. So here's your tibialis posterior tendon kind of coming along here. So if that malleolus wasn't there and that tendon, say, just kind of came down in this direction, it would be much more difficult for it to perform inversion. It may not even be able to do so. It would change the angle of pull of the tendon. So that's why both the medial and lateral malleolus, why they have such an important function beyond just. And again, there's bony stability to the ankle as well that they help to provide for, particularly the lateral malleolus because it's so big and has such a distal projection. But this is the big part of the reason of what the malleolus on each side does as far as biomechanically for the foot and ankle. So here are the bones of the foot. Now, much like the wrist and hand, you have a very similar structure. The only thing is you're just dealing with some different names, okay? So instead of the carpal bones, you have the tarsal bones, okay? So if you look, the breakdown of the foot, you have the rear foot and you have the midfoot right here, okay? So rear foot, midfoot. In the rear foot and in the midfoot, you have the 7 tarsal bones, okay? So the 7 tarsal bones are there, so make note of the name as you're kind of going through this and looking at your readings. In the forefoot, moving down the foot here, you have the metatarsals. Similar to in the hand, you have the metacarpals. Okay, so in the hand, you have the metacarpals. In the foot, you have the metatarsals. And then, much like again, very similar to the hand, you have the phalanges. Okay, so you have the phalanx bones, the distal, middle, and proximal, everywhere except the first toe, where you only have a proximal and a distal. Okay, so again, it's kind of the same as the hand. In the thumb, you have a proximal and distal phalanx, and in the 4 fingers, you have a proximal, middle, and distal. The same thing in the toes. Okay, the great toe, you have a proximal and distal, and then in the lateral 4 toes, you have a proximal, middle, and distal. Okay, some things to note. Okay, so again, sometimes these little facts can kind of help just kind of understanding the overall general anatomy. The talus, so a couple things about some of the tarsal bones. The talus has no muscular attachments. So the talus is a bone that no muscles actually attach to. The navicular is between the talus and three cuneiform bones. The cuboid is between the calcaneus and fourth and fifth, and then the calcaneus obviously is the very prominent insertion site of the Achilles tendon. Okay, distal to the tarsals, you have the five metatarsals, and then distal to those, you have the phalanges, or the toes in this case. And as I had talked about on the previous slide, in the phalanges, they each have three individual bones, with the exception of the big toe. And here's something to kind of keep in mind. A lot of people were still confusing when they were looking at the bony hand, and when you're looking at pictures of the foot, make sure you're able to separate and are aware of where the metatarsals are and where the phalanges are. Okay, some people in the hand were kind of mixing up their joints when they were looking at the metacarpals and the phalanges. Make sure in the foot, don't make the same mistake. Okay, some people made that mistake on a lot of the quizzes in the last section and on the last exam, so don't make that mistake here. There's also two sesamoid bones. Remember, we said a sesamoid bone is a bone that kind of sits in the middle of a tendon. So right beneath the first MTP joint. Okay, so what would MTP stand for? Okay, MTP would stand for metatarsal phalangeal joint. Okay, so that's the joint between the first metatarsal and the first phalanx bone. Okay, so that's important. Again, make sure you don't confuse these abbreviations, and make sure you also know to number them. So when I'm asking for specifics, if I have a marker on the first metatarsal phalangeal joint, I want to denote it as the first metatarsal phalangeal joint. Just don't put metatarsal phalangeal joint. Make sure you put the correct number. So that's going to be important for testing purposes. So these two bones sit right beneath that in the flexor hallucis longus tendon. And again, what that's going to do is just give that particular muscle greater leverage and strength, which, as we know, as we'll talk about it a little bit, we don't get into a whole lot of specifics regarding overall function, meaning, we talk about the function of the muscles, what they do just from a straight action standpoint. But, obviously with walking, there's a lot of stress on the first toe, and there's a lot of force needed to be put there. So that's part of the reason why those sesamoid bones are there, just to give that flexor tendon to the big or the great toe a little bit more leverage. So again, here's just revisiting that same picture. So think about all that we said. Again, one of the two big mistakes a lot of people were making in regards to the hand is that we were kind of mixing up this part, meaning not being able to differentiate all these different joints kind of in this region right here that was equivalent to the hand. So again, just to go through it one by one, these are the metatarsals, okay? This would be this joint right here would be the first metatarsal phalangeal joint. These are the phalanges here. Each phalange has each phalange is made up of phalanx bones. The lateral four each have three. 1, 2, 3. The first one has only 2. Okay, so if I put a marker here, and you can see where the laser pointer's on, you would call that the first metatarsal phalangeal joint. So here's a discussion board question. So I'm going to put a discussion board post up for this. I want everybody to answer it. Okay, so the first discussion board, I'm going to ask you two. Okay, it's going to be all in the same thread. All right, I'll get it posted up. Okay, so landmark question number 1 for the ankle, foot, and lower leg discussion board post? What is this joint right here? Okay, so you should be able to see the laser pointer. What would be the name of that joint? The specific name. So if you're taking notes right now, write down what you think that would be. And then when I put the discussion board post, I want you to put that for number 1. Here's number 2. So what specific joint would that be? All right, so I'm going to put a discussion board post up to accompany this talk, and I want you to put 1 and 2, okay, the two joints that I gave as a part of this, okay? So make sure you write those down and get them in there, and I'll put that up as a discussion board post to make sure everyone's paying attention with what's going on. Okay, that concludes this part. We're going to begin the next part by talking about the ligaments.